some implementation science classes where we really introduce the concept of implementation science and why implementation science is really important. So as a highlight of mentioning, implementation science is a very new field. I think it's not even 15 years old. You can correct me if I'm wrong, but it's a new field. And implementation science came into play with the essence of really bridging the gap between what we know and what we do. There's a lot of information out there in the world. There's a lot of efficacy and effectiveness research that has been done, but really the putting that into action is the main challenge. And therefore, implementation science is that new field that came ready to bridge the gap between what we know and what we do. So there's a lot of things to talk about in implementation science and implementation research itself, but mainly there are a lot of processes. It's really an iterative process that, and we have a lot of frameworks that can help us guide us through the implementation process. And we have talked about some of those sessions in our previous series of lectures in implementation science. Now, implementation outcomes are going to be how you measure that your implementation process is a success. So these are going to be how you're measuring if the implementation process is working or it's not working. And we'll see a mix of several outcomes and as we move along. And the measures are going to be how you measure the outcomes now, if they are really working, how you measure, for example, if your intervention is acceptable, how you measure if there's fidelity in your intervention. So that is in a nutshell what we are going to just briefly on a surface level. I give you a primer of what we are going to talk about. And of course, you can feel free to interrupt me at any point if you have questions, all area of clarifications, or if you just want to add on anything. So this is basically the outline of what I want to discuss about. I just want to give a broad overview of what implementation outcomes are and why are they important, and why is it important whenever you're having an intervention that you're implementing at a particular setting. Why is it important to always have at the back of your mind, all in the implementation process, on thinking about these outcomes. But we'll see a couple of examples in some of the published papers that our group has done, which really assess the implementation outcomes. And of course, I'll share some few resources which can help you in your, if you're planning an implementation science project, really to help you know how to measure this implementation science outcome or implementation outcomes. So that is broadly what we are going to be covering for the next time. Now, I prefer, before starting any implementation science class, to really talk a little bit about this slide. And this, I call it a power slide, because it summarizes everything that implementation science, implementation research, or dissemination and implementation research does. So almost always in implementation science, you always need to have an intervention that you're trying really to implement in a setting. And we call this the thing that you're trying to study. For example, we might have, we know, like, for example, aspirin can reduce the risk of maybe having myocardial infarction or having coronary artery diseases. So there is evidence already that this aspirin works. Now, effectiveness research, also I want to highlight here, is gathering evidence around the thing, if the thing really works. For example, our group has done studies here in Kilimanjaro region, and it found out that out of every 10 injuries who are coming in the emergency department, 3 out of them are presenting, their injuries are alcohol-related injuries. They come with injuries because of alcohol consumption. Now, there is an intervention that can help these patients who are coming in the emergency department due to alcohol use, that can really help them reduce their alcohol consumption process. And this is called the brief negotiation interviews. Now, there's evidence that the BNI, when it is implemented in settings, it can help really reduce the risk of these patients to, again, continue consuming alcohol. It's like a helping process. But now we don't have evidence whether this intervention, all these things, works in low and middle income country setting. So a step back toward that will be to gather more evidence, or if performing effectiveness research to look at whether the BNI can work in settings, low and middle income country setting, as it does work in high income country setting. And this broad field of trying to gather evidence if your intervention really works is what we call effectiveness research. And that is going to be really different from efficacy research. And effectiveness research is very important because it affects the implementability of your intervention. If there is no enough effectiveness evidence, some of the outcomes which are related to implementation outcomes and service outcomes might be really low. So it's always important to have enough effectiveness evidence around your intervention before you really try to implement it in a particular scene. And that is really important to note. Now, for implementation research now is now putting the intervention or the thing or doing it in a particular setting. For example, we know that the BNI now works in settings like Tanzania, that if we do a brief interview with people who have alcohol consumption risk, it works in this setting. Now, implementation research now tries to implement the thing or the intervention, for example, or if aspirin, for example, works to prevent myocardial infarction, to implement it in a particular setting, and that is doing the thing or implementing the thing. Now, the implementation strategies are going to be the ways in which we implement. For example, for the previous talk that I just introduced, we found that the BNI can work now in Tanzania. Now we are trying to investigate what are the best possible ways for this intervention, the BNI, to be delivered to patients. Should a nurse maybe, for example, do it? Should it be done maybe by a computer? Should it be done by community healthcare workers? And these are going to be the strategies on you putting the intervention really into place. And implementation strategies are going to be very important in implementation science because they give you a picture of the sustainability process in the long run. And remember, there's a lot of what we know, but we do too little. And the things that we do, like, for example, I'm talking about research, they don't last for a long time. And this can be attributed by what strategy are we really putting in place in implementing the intervention. So whenever you see in implementation research or whenever you are leading implementation science-related articles, implementation strategies are going to be the ways in which you put your intervention into place. In other words, how are you doing the thing? What are your plans of implementing the intervention in a particular setting or context? Now, the outcomes, which are the aim of today's discussion, is really how well or how much and how well is the thing performing. For example, you have your intervention in place already, maybe in the emergency department, that is targeting to help injury patients to reduce their alcohol consumption. How much well are you performing? Is there fidelity around your intervention? Is the intervention acceptable around your setting? How many emergency physicians are adopting or integrating the intervention into their routine clinical practices? And therefore, this is going to be very important because it gives you an alarm of how well the intervention is performing in your setting. So I hope that was clear to everyone. And if you have anything to add in this important slide before we go to the next parts, you're welcome to. But I wanted to make sure that we are all on the same board in understanding these terms when it comes to implementation science.
This is a great slide. Thank you, William.
Yeah.
I really like how it's portrayed.
Yes, now that we have a clear understanding, let me just charge my computer. But now that we have a clear understanding of that important slide, we have an understanding of what implementation science is. that we are trying to really build the gap between what we know and what we practice, and we know what the thing is. Now, the implementation outcomes, as I might have mentioned in the previous slide, is that these are going to be the effects all of deliberate and purposeful action to really implement new treatments. Like, this is going to be what you see at the end of the day. Now, we have different types of implementation outcomes, and depending on what you lead, but we have what we call the Proctor's outcome, where like we have implementation outcome. I will explain this in coming slides. But these are some of the implementation outcomes which are commonly known, that acceptability of your intervention or innovation, for example, in a particular setting. For example, you might bring the BNI at the emergency department, and this is the brief negotiation interviews, but the clinicians, they don't accept it. So in order for you to measure the success of your implementation, you really have to study around the acceptability of that intervention in that particular setting. And it basically means the perceptions among different stakeholders that the intervention is agreeable and it's suitable to the particular setting. And really how you can measure acceptability is a mix of you doing, it's a mix of qualitative works, and you can use questionnaire, and you'll see we have a tool that can measure acceptability as we move along. But another implementation outcome, which is really common and it's important to understand whenever you're having your intervention in place, is adoption. And by adoption, we really mean how much willing are people do people want to start employing the intervention in the particular setting. And this is very important, adoption, because you might have your intervention and then you're putting it in place, but people are not using it. And therefore, at the end of the day, you find that there is no any change in different outcomes. So in order for you to really tailor or for you to fasten the adoption process, it's very important for you to design the intervention, or at least adapt it together with the setting, with the place where you're trying to implement it. And this is why in implementation study design, we always talk about the importance of performing co-design session with the end users of the implementation, the key stakeholders, or what we call the champions. It's very important, and that can really help in the adoption of your intervention, and of course the acceptability and some of the other outcomes. So the importance of co-designing session really can affect the adoption and acceptability and the rest of the implementation outcome that we're going to see. And of course, adoption can be measured by different ways. One of the way we can measure adoption is by us just looking at how many people, maybe how many emergency care physicians are using the intervention after it has been put in place, or how many nurses, for example, are using the intervention after it has been put in place, how many are integrating it into the routine clinical practice. Another important implementation outcome is appropriateness. Appropriateness is affects everything else. Of course, these outcomes are dependent to each other, but it basically means like the perceptions of different stakeholders on the relevance of the intervention in their particular setting. So, for example, we have the BNI, and in the BNI, this was maybe we have a version that is for high-income countries, and that might not be appropriate when it comes to low and middle income country setting. And because there is no appropriateness, it might not be relevant to that particular setting. So it's very important to assess the appropriateness of your intervention for a context specific. And you can do that by really trying to study the context, and that is why it is always very important to study your context, to do at least a formative research or the formative assessment of your setting in order for you to understand the implementation climate, or the place where your where your intervention is going to be implemented, if the intervention will be really appropriate for that particular setting. So you can do that by really studying of course, by performing co-designing session with the key stakeholders to understand the appropriateness of your intervention before you really put it into place. Another important implementation outcome is costs. Now, we cannot stress much about cost. And when we talk about costs, we are talking about implementation costs, because implementation cost is going to really affect the sustainability of your intervention in the long run. So as I mentioned earlier, our group implemented and a big trial was done for almost 5 years to assess the feasibility, acceptance, and a lot of implementation outcome of a BNI in the emergency department. Now, for the BNI to be sustainable, we really need to understand the cost of implementing it in the emergency department. We really need to identify the less cost-effective methods of implementing the intervention so that it can be sustainable in the long run. And implementation science gives us the luxury of really trying to study ways on which we can implement, we can look at cost in a different way by, for example, if you use the CIFAR tool, you can study the inner setting, you can study on ways to really integrate intervention in routine clinical practices so that it cannot add an extra cost, and it becomes really integrated into the routine clinical practice, and this can really help you to understand costs. Now, cost really impacts the implementation sustainability, and this is really important. And the costs that we are talking here, the implementation cost, and you can, of course, measure this by really studying and looking at how this can be sustainable in the long run. So I would say, like, before putting an intervention into place, it's really very important to have a clear picture on how much that is going to cost the implementation of it. You really want to find less costly methods to really put your intervention into place. Now, feasibility is also important. Feasibility is basically the extent to which an intervention can be carried out successfully. Is it feasible in that setting? And feasibility really, for you to do to look at feasibility, of course, again, you can perform co-design sessions. You can study the intervention before putting it into place with the end users. Now, fidelity, again, is now you have your intervention. When you're studying fidelity, you are looking at, is the intervention being implemented as it was supposed to be implemented? So we have what we call the fidelity intervention measure. We'll see it, it's called the FIM. It really tries to study, are you implementing the intervention as it was supposed to be implemented? And fidelity is very important because it affects not only it's an implementation outcome which affects other outcomes like the patient outcomes. For example, for our BNI, which was implemented in the emergency setting, there is a certain way the BNI has to be performed for us really to see the effect of it, and the outcome was really the reduction of the number of binge drinking days for this patient. If the intervention is not performed as it's supposed to be performed, it will have an effect to the outcomes of the patients that you are studying. So it's always very important to assess fidelity, and fidelity can be assessed by basically performing quality assessment every now and then to really make sure that your implementers, all the intervention performers are doing it as it is supposed to be performed. Another way in which we can ensure intervention fidelity is by really performing training for the people who are going to be implementing the intervention. And this is very important because if fidelity is not taken into account, then the intervention or implementation won't be done as it's supposed to be done, and therefore that can affect a lot of outcomes of the study and patient outcomes. So other outcomes in the PLOCTA's implementation outcome are penetration, and this is basically the degree to which the intervention has been integrated now into the system, all into a hospital, for example. For example, now, for our case, now that we have We have evidence from a clinical trial that the intervention can reduce binge drinking days to patients. We would want to see in the longer run in how many hospitals can this be integrated and become sustainable. And that process of looking at penetration is penetration. How much has the intervention been integrated in the long run in a system? It can be in a hospital or anywhere you're doing a study. So there's a questionnaire to assess penetration. And I think the link to this should be down in the slides, which should be also shared. So sustainability, of course, we have talked about this, is the extent to which the intervention can become sustainable in the longer run. And you have really to have sustainable plans of your intervention. Otherwise, it won't be there for a longer run. And really to study sustainability and to ensure sustainability of intervention, you have to really engage the key stakeholders. So these are what I would call the main implementation outcomes. There are more to this list, but these are some of the main and the most common implementation outcome. We also have what we call the CIFA outcome addendum, which tries to really put this implementation outcomes in a context of a framework and the CIFA framework. And we might hopefully see that toward the end. But you can also use some of the evaluation frameworks, which I think we talked in our previous series of lectures on implementation science. You can use, for example, the RIEM framework, where you're looking at the reach, the number of people that have access to your intervention as some of your implementation outcome measures. And we'll see some of these in the coming slides. So whenever you are doing implementation research, these are the things that you want to put on your fingertips, like to assess your implementation outcomes in the process. And I think I tried to really explain some of them, and we'll see how to measure each one of them as we move on. So now, after seeing that broadly, I think we might have a picture now of why it's important to
William,
to
can I ask a
yes.
question on the earlier slide?
Yes, of course.
Can you come back to it, please? Yeah, so where is this framework for outcomes coming from? What is the reference?
So you're saying, Joe? Sorry, I missed that.
Where is this framework for outcomes coming from? What is the source?
It's the source for this should be down. This is from the Proctor's outcome. You should have seen it. So this is what I just explained.
Yeah, no, I'm familiar with the Proctor. I'm asking particular this table 1 that you were just guiding us through. Where is this table 1 coming from?
I think I can check that maybe and get back.
I think it's very important to edit the citation every time you're referring to something that someone else created. And I'm asking that because there's a comment that I want to make. So when you look at this outcomes here, this is a proposal of outcomes, right? I would say that the area of implementation science is not one area that has a very concise concept of what they understand as outcomes or not. Things are kind of the different proposals for frameworks have been condensing or congregating into a common theme. But one thing that I particularly don't like very much about most of the implementation outcomes frameworks is that they are very process oriented. And so here you would follow acceptability would be what follows under participant satisfaction, while some other outcome frameworks would have a satisfaction measure and separate it from acceptability. Because I think it's at least for me, in my perspective, I think it's important to differentiate the acceptability of the intervention from those that are performing the intervention from the satisfaction of those receiving, that seems to give me a little bit more of a patient-centered or a participant-centered measure of implementation versus a more structured system performance. And I feel like CIFAR, for instance, receives a lot of criticism because it's heavily focused on this corporative or very oriented towards the process or the institution instead of focusing also on the individual receiving it. So that's why I think it's important to always list out the source and understand what's in there and what's not there. The other comment that I want to make for folks in the room is that these words are important. And I would pay particular attention into this framework as you are trying to derive implementation studies, because we're coming to a phase where we're not making this up anymore. We are following frameworks, and the words mean different things. So here, what William very clearly explained to all of us is what the outcome means by definition. And there's no one particular way of measuring those, but they have a very specific definition. We don't want to use them as synonyms, and we don't want to use them as a common sense definition of what that means. Okay, so this is important. This is a very important slide when you think about designing an implementation outcome evaluation. Thank you, William.
Yeah, thank you, Joao, for that comment. Yep. And I think I'll add some of the references before I share the slide. But yeah, so implementation outcomes are very important because they are going to help us to really understand which strategy works best. And I think I explained a little bit about what we mean by implementation strategy. And implementation strategies are going to be how are we, what is our plan for really putting the intervention into that setting. And I mentioned earlier on, like, for the BNI that was being performed in the emergency department, the number one implementers were the nurses who were delivering the intervention to the patient. But someone else can think about a different strategy and say, maybe the nurses are too busy. How about we try to just send maybe messages to these patients? Or how about we try to use an app maybe to deliver the intervention to this patient? And then you can do a study to try to look at how much among the patients who the intervention was delivered by a nurse, and among the patients who we used maybe a computer software to deliver the interview among these patients, what were the degree or the amount of reduction of the binge drinking days among these patients? And therefore, if you look at outcomes and see the difference between the two strategies, all three, and you find that maybe for those patients who the intervention was delivered by the nurses, they had a more number of binge drinking events reduced, then you can say maybe the best intervention strategy was going to be maybe using the BNI being delivered by a nurse. And that is important because you have used some of the implementation outcomes to really identify which is the best strategy that can help you deliver your implementation strategy. So implementation outcomes are going to be important because they help you. And for example, in the example that I just mentioned, you can also ask for acceptability of patients when one strategy is delivered compared to the other strategy. And that is what the first bullet means. But again, implementation outcomes can help you understand the feasibility of your intervention or of the thing in the particular setting, but they can also have help you understand the costs, and therefore, in terms of costs, you can understand and you can get a picture if this is going to be sustainable in the long line. So also, they can give you an information about scaling up of your intervention over time because it gives you understanding of, for example, I mentioned costs, appropriateness, and some of the other implementation outcomes that I mentioned. So this is why implementation outcomes are going to be very important in the long run. So I think it's not limited to this, but I wanted to mention these few importances of implementation outcomes. So this is a conceptual framework, and it's the farmers. It's what we call the Proctor's outcome that really tries to look at outcomes, implementation outcomes. Then we have service outcomes, and then we have the client outcomes. So these are different. We have talked about implementation outcomes, but now service outcomes are going to be the outcomes of the service or the intervention that you are delivering to a particular population, and they are basically around efficient safety of the service or the intervention that you are delivering to that population, effectiveness, equity, patient-centeredness, and timelessness. And these are what we call the service outcomes. And then the client outcomes, whenever you're studying, you want to understand the satisfaction of the clients on your intervention, because satisfaction can affect a lot of things. It can affect the acceptability, it can affect the adoption, and therefore even sustainability in the long run. But these are some of the client outcomes. But of importance today is going to be implementation outcome. But of course, they are affected by all other outcomes altogether integrated. So this is what we call the Proctor's outcome, and you'll see this in many implementation research findings, and it's very important to have an understanding of it. Now, I want to go through the individual components. Of course, I have papers which were explaining different implementation outcomes, like, for example, acceptability, what you really want to look at in acceptability and how you can really measure acceptability and how you can study. But this is from the University of Washington website, where they really try to explain a lot of implementation science resource concept, and I would recommend to really use the website. I always have the link in my presentation, but I didn't put it. But acceptability is really measured from looking at the perspectives of various stakeholders on your intervention. And here you can really include a lot of users. For example, you can study administrators, any person who is the end user of your intervention, to look at how are people perceiving my intervention. But we also have a rating scale for acceptability, and I will show it towards the end, that you can rate acceptability. But the measurement of acceptability in a rating scale is really very subjective, and it's really prone to social desirability or a bias which occurs. A person says this is acceptable on a rate of 0 to 10. How much acceptable is this? Then they rate it, but that is very prone to bias. So it's always important to have qualitative assessment to really study acceptability of your intervention around your study population. Adoption, we have talked about it. So I won't really stress about much of this. We have talked about them individually. Of note, I want to stress on feasibility. And for example, for the study that we did, I mean, not we did, like the group did on the brief negotiation interviews, there are a lot of papers which were done about feasibility around it, and this is just to highlight it's always important to report on feasibility of your intervention. If it's feasible, that can affect a lot of other outcomes in the long run. And these are the papers, and this is the link on how you can access some of, and here they explain well how they assess feasibility, and that can really help you. So fidelity, as I mentioned earlier on, it's really the degree to which an intervention is implemented as it was prescribed or as it was planned to be performed. And this is very important because it can affect in the long run it can affect the outcomes for the patient if the intervention was not done per protocol. And so when you are doing fidelity, you have 5 main dimensions that you want to assess, and you want to look at adherence. Are my people who are delivering the intervention, are they adhering to the intervention? You really want to look at the quality of delivery of the intervention, and you really want to look at the program component differentiation, and some other aspects like exposure to the intervention, because that can also affect fidelity, and patient responsiveness or involvement. These are some of the 5 key dimensions that are really recommended whenever you are studying fidelity of an intervention as an implementation outcome. So you can measure fidelity through self-report or rating scales and direct observation and coding, maybe of audio and video tapes of actual encounters, or provider client participation in the process of implementation. So we have the fidelity of intervention measure. We call it the FIM. I'll show it in the next slide. It's a rating scale which is used to assess fidelity. But really, I think the best way to assess fidelity is the best way to ensure fidelity, as I might have mentioned, is really to ensure that you perform adequate training of your intervention to the people who are going to implement it. That is very important. So penetration, I think I mentioned earlier, it's basically the integration of a practice or a service or that intervention in the place that you want it to be implemented, and that affects sustainability. And we have papers which, and the link of course is here. You can go and read on how this study really integrated penetration and reported it as an implementation outcome. Sustainability, we have also talked about that, and sustainability is very important. Now, these are some of the commonest measures of some of the implementation outcome. For example, we have the acceptability of intervention measure. We call it the AIM. This is going to measure, it's a rating scale which is going to measure the acceptability of your intervention. And it has 4 questions mainly, and it is always rated on a scale of 1 to 5. So you have your intervention, for example. For example, we had the BNI and we put it in the emergency department. So one way of measuring acceptability would be to use this AIM. It would be to ask maybe, does the intervention meet your approval? So you ask the person if they completely agree or they completely disagree or they completely agree. So this is an example of a rating scale of measuring acceptability of an intervention. Another measure is the intervention appropriateness measure. It's the IIM. So it, again, they all have 4 questions which are rating scales that can assess the intervention appropriateness. And we also have the feasibility of intervention measure. So as I mentioned, these are really subjected to social desirability, and they are really a subjective, they are, I would call, not quite a reliable measure to really assess your implementation outcome. So you can do a rating scale, and maybe you can also do actual qualitative work to really listen to the people and to understand the acceptability of a particular intervention. But this just gives you an overview of how to do that. And this is a link that can take you to this document and how really they used they explain how to use this when you are doing measuring the implementation outcome or the intervention outcomes. So I mentioned earlier on that we had the Proctor's outcome measure, and we spent much time explaining it. But some of the evaluation frameworks, the Nielsen's taxonomy, can be used to assess implementation outcomes. For example, you want to know maybe how many people has my intervention reached, and this is the REAIM framework, where R stands for reach. So you can look at how many people are really using the intervention, and that is for the reach. And then effectiveness, how do I know my intervention is effective? And that can also be an outcome for the implementation, and it can be measured in that way. But adoption, of course, we have mentioned it. And fidelity falls under implementation in the RE-AIM framework. How do I ensure the intervention is delivered properly, or there is fidelity in this intervention? So some of the evaluation framework like RE-AIM can really help you and guide you really to have integrated with some of implementation outcomes. So also the CIFAR outcome addendum tries really to break down some of the implementation outcome, and we have talked about much of this, but the good thing about the CIFAR outcome addendum really has two main implementation outcomes, and you can see it clearly here that you have anticipated implementation outcome, and then you have actual implementation outcome. So so the anticipated implementation outcome are going to be indicators of anticipated implementation success or failure. That what do you anticipate with regard to that particular intervention? And then the actual implementation outcomes are indicators of actual implementation success. So this is what you see after you have implemented. So whenever you're using a CIFAR framework as your implementation framework of choice, you want to really tally your outcomes with the CIFAR outcome addendum. And I don't have a link for this here, but this you can find it online and really understand how to integrate the CIFAR outcome addendum together with the CIFAR framework. And for example, here you have the determinants from the CIFAR implementation determinants, which you can get by really studying the settings or the domains in the CIFAR framework. And then you can really integrate the CIFAR framework with the CIFAR outcome addendum. And I think that was briefly what I wanted to talk about today. I am now open to any questions or more comments or points of addition from you, but this is what I prepared. Thank you so much for listening, and you can reach out to me if you have any other questions through this email. Back to you, Joao.
Thank you, William. Thank you very much. Yeah, this was great, very detailed, and very concrete, which I like it very much. I think this is a great intro video for anybody that is designing an implementation study and needs to find outcomes and think about how to measure them. That was very well done. Anybody have any questions for William? Any pressing issues they are dealing with in this space? Okay. A lot of folks congratulating you from the presentation, William. I do want to mention that please come back to this presentation whenever you're working on an implementation outcome study, instead of texting me asking for a reference for it, okay? You just got a very good reference for it, and a very good detailed presentation on it. William, this is great. I would invite you to think about having other sessions where you talk about particular outcomes and different ways they have been assessed with examples. I do want to say one of them, such as the AIM IM tool you presented, I'm particularly not a fan of that because I feel like it's very generalistic and it's not up to the point. But it talks a little bit about the issues with the field that has a lot to progress in how some of these things are tracked. But it also gives you a lot of leeway to define what your metrics are. So being very consistent with how you define them, and then how your method of measuring it will be applicable, it's important. The other thing that I would like to challenge you all to think about is when you design an implementation outcome evaluation, you also want to think about how these implementation outcomes could be measured in more rigorous designs beyond a qualitative study. So if I am doing a study to evaluate the implementation on a quasi-experimental design, how is my metric being measured over time? What is a source of success? This is also an area where the field still lacks a lot of information. We don't really know what improvement in adoption is needed and how that refers back to an adequate implementation. All of those things are yet to be discussed. So William, again, maybe having sessions where we talk about each outcome and how they have been measured, what it means, will also improve our toolbox in the sense. Okay?
Yeah, Joe, I agree with you 100%. I think studying every implementation outcome can be a study on its own. So I think it is maybe I just wanted today to give a brief overview of like just a clear understanding of to set the foundation, just to understand whenever you hear maybe a Proctor's outcome, then I think every implementation outcome for itself it's a topic, I would say, and I think it needs to have an integration with the study design, as you mentioned, and it's really something maybe we can plan in the future and have a discussion around that area. I think that will be high yield for people to understand. Yep.
Yeah. All right. So let's organize that. That would be great. Okay. Thank you, William. I'm just pulling up our schedule to see what we have lined up. So I
Okay.
see here that next week we have João Vitor working on creating knowledge graphs. That's a very exciting one, João. I want to point out that when you look at our schedule, all I see here is João Vitor, and then I see William and Nathan here. So I want to reiterate to folks in the room, this is a good time for you to get feedback on a study that you're doing, that you want some help. This is a good time for you to try to get some mentoring around an analysis that you're conducting or something that you are studying. Use the time for it. This is not necessarily just a time for a lecture. You can bring an analysis you've done and you pull it up so we can talk about challenges and questions and difficulties. You can also bring in a topic you're studying and bring it for questions and conversations around it. Okay? So put your name in there. If you try to get me and my time to review a result, you might not get it as fast as if you bring it here. And here you get more attention than just mine. So keep that in mind. Okay? All right. And then looking at our seasonal template building, we still have several templates that have none listed out. So if you're not involved on this process yet, and this is something you would like to work with and support, please add your name here or make sure you talk to Leticia as she's helping us organize this part. All right? Cool. All right. We'll talk again next week then. Thank you, William, very much. And see you guys next week. Bye.
Thank you.
Thank
Thank you,
you.
William.
Thank you.
Bye-bye.